In the spacious, well-lit atrium of a community center, two public health professionals, Maya and Tom, met to discuss the ongoing global health crisis. Seated at a safe distance from each other, with masks on and hand sanitizers close by, they prepared to share insights and strategies for the future, drawn from their experiences during the pandemic.
Tom, it's been quite a journey handling the public health responses to this pandemic. I think it's critical we take stock of what we've learned so far. So many lessons on preparedness and resilience.
Absolutely, Maya. The scale and impact of this pandemic were unprecedented in modern times. It forced us to rethink and adapt our strategies on the fly. What do you think were our biggest takeaways?
Well, let's break it down and discuss it thoroughly. Question: Tom, in your opinion, what are the key lessons we've learned from managing the pandemic that we can apply to future crises? A. The importance of robust health surveillance systems. B. The need for rapid, transparent communication. C. Strengthening global cooperation and resource sharing.
Answer: A. The importance of robust health surveillance systems.
Tom, I think one of the crucial lessons is the importance of having robust health surveillance systems. Option A. These systems are essential for early detection and response, which can significantly mitigate the impact of a crisis. It's about being proactive rather than reactive. Without effective surveillance, we're always a step behind in managing the spread of disease.
That's a solid point, Maya. Effective surveillance not only helps in early detection but also aids in the efficient allocation of resources where they are most needed.
Exactly. And considering how quickly things can escalate, being prepared with a well-oiled surveillance mechanism can make all the difference in controlling future outbreaks.
As Maya and Tom continued their discussion, they dove deeper into the importance of communication during a crisis.
You're right about surveillance, Maya. And building on that, I think communication has played a pivotal role too. How well do you think we managed the communication aspect, and how can we improve it for future emergencies?
Maya considered the past months, recalling both the successes and the challenges they faced in communicating with the public.
Question: Maya, how crucial do you think clear and transparent communication is in managing a public health crisis, and what strategies should we employ to enhance it? A. It's absolutely essential. Timely and accurate information reduces public anxiety and improves compliance with health directives. B. It's important, but we also need to balance it with privacy concerns. C. Communication is less critical than logistical responses such as vaccine distribution and hospital readiness.
Answer: A. It's absolutely essential. Timely and accurate information reduces public anxiety and improves compliance with health directives.
Maya, clear and transparent communication, option A, is not just beneficial, it's a necessity. Timely and accurate dissemination of information can drastically reduce public anxiety and skepticism, which in turn enhances compliance with health measures. People need to trust the sources of their information, and that trust comes from consistent and clear communication. Absolutely, Maya. I've seen firsthand how misinformation can lead to fear and non-compliance. Effective communication strategies, like regular updates and using multiple platforms to reach diverse audiences, are key.
Definitely. And it's not just about broadcasting information, but also about engaging with the community, addressing their concerns, and adjusting our strategies based on feedback.
Their conversation shifted towards international cooperation, another critical lesson from the pandemic.
Speaking of adjustments, this pandemic has shown us the value of global cooperation. What are your thoughts on international collaboration going forward?
Question. Tom, given the global nature of health crises, how important is international cooperation in terms of sharing resources, information, and strategies? A. It is vital. No country can manage such crises alone, and global solidarity is essential. B. It's useful but complicated due to political and economic differences. C. Each country should prioritize its own citizens first before international aid.
Answer. A. It is vital. No country can manage such crises alone, and global solidarity is essential.
Tom, international cooperation, option A, is absolutely vital. The pandemic has demonstrated that viruses know no borders. Sharing resources, information, and strategies on a global scale not only helps contain the spread more effectively but also accelerates the development and distribution of vaccines and treatments. Solidarity, rather than isolation, will prepare us better for future challenges.
I agree, Maya. We've seen remarkable progress when countries work together, like in vaccine development and sharing critical data about the virus's behavior.
As their meeting drew to a close, Maya and Tom felt reassured by the robust discussion and the actionable insights they had shared. They recognized that while the journey had been tough, the lessons learned were invaluable for future preparedness. With a firm handshake and a commitment to apply these lessons to improve public health strategies, Maya and Tom left the community center more equipped to face future health crises, hopeful for a more resilient and cooperative global response. Here's a review of key words and phrases related to the theme of lessons from a pandemic.
Health surveillance systems. Tools and practices used to monitor public health, detect diseases early, and respond quickly to prevent widespread outbreaks. Transparent communication. Open and clear sharing of information, ensuring that all stakeholders, including the public, are timely informed and misunderstandings are minimized.
Global cooperation. Collaborative efforts between countries and organizations worldwide to share resources, information, and strategies for managing global issues. Public anxiety. The collective unease or fear among the public, often exacerbated by uncertainty and misinformation.
Compliance with health directives. The extent to which the public follows guidelines and instructions provided by health authorities to prevent and control diseases.